I think this kind of opened the doors to some discussion about, I think in healthcare we talk a lot about patient-centered care and making things that meet those express needs, but we don't always go out there and actually engage our patients in that process. And so, we knew that that's what we wanted to do. We wanted to create these programs that met their express needs. And so in order to do that, we actually needed to go out there and understand their express needs, because this population, we don't know those answers in BC. But this is where we ran into some other issues. Within Canada, BC, and even locally, there's no tracking for adult home tube feed users. We actually don't know the full extent of this population, where they are, who they are. And so this led to kind of a further step back, is we need to find the population first. So again, this all kind of came out of the idea of let's improve care, but we ended up really having to focus back on just finding the population itself. And so that started our research journey. So in 2016, I led a team of students. We have dietitian students each year do research projects, so we were able to leverage that group. Some healthcare leaders and frontline staff to actually try and look at the literature and specifically the charts to get an idea of who is out there. So we looked at charts between 2012 and 2016 and collected information on any adult who went home with a new tube from a Fraser Health facility within that time period. And then we also looked at how often they were getting follow-up with a dietitian to better describe what that rates of follow-up looked like. And so we found that a fairly sizable population for Fraser Health was going home. Over that 3-year period, there was 390 new adult home tube feed users discharged. And what's important to remember for that number is it does not include those individuals who had a tube placed in another health authority, such as Vancouver Coastal, but live in the Fraser Health region and would receive their community services there, and those who already were living with a tube. We only looked at those newly discharged. So again, about just over 100 people going home a year newly on tube feeds. When we looked more specifically at the demographics, we found population distribution. If you are not familiar with the Fraser Health region, Surrey is our largest population size. So not surprisingly, you can see that larger red circle there denoting that Surrey did have a large proportion of people going home. And we found that the demographics were very similar to those in the few studies describing other Canadian populations, mostly male, and a little bit of a younger than the typical hospital population. And that has a lot to do with the common underlying condition of head and neck cancer. That population tends to be male and tends to be a little bit younger, so reflected in those numbers. But the other interesting thing we looked at was income. And we found that the median income, if we look at how much tube feeding on average costs, households would be spending about 16% of their household income on tube feed formula, and that's pre-tax. To put that in context, the same year of 2015, if we looked at how much it costs to feed a family of 4 using some standardized provincial numbers, we would expect a family of 4 to be fed on 16.6% of an individual's income, a household's income. And in this situation, this population, we're suggesting that almost all of that money that should be feeding a family for is only feeding, one home tube feed user. So identifying, some potential for some key economic issues for this population. The other thing we found that was very surprising was the very low rates of dietitian follow-up. So only 25% of those people in our sample actually saw a dietitian in the community up to 3 years after discharge, which as a dietitian was concerning, but we allowed it to reflect on what we had already had concerns about our community supports. So we definitely had a lot of questions coming out of this. We went on the next year kind of building on that study and looked at the same population but using a different team, some different research students. And we looked at the healthcare usage behaviors of this same 390 patients. And what we found was shocking. We found that there was a total of 311 tube-feed related visits to either the emergency room or the hospital ward over 6 years, and that these visits were estimated to cost up to $14.3 million for just this small group of 390 people. And you can see, based on the length of stay, part of that has to do with several of the lengths of stay in the hospital being quite long, up to about 220 days, but a number that's fairly staggering. So these two findings together, the identification of poor usage of dietitian services and very costly tube feed related visits, raised a lot of questions for us about what is going on right now, and how are people experiencing tube feeding in the community, and how is that affecting their use of the healthcare system. And so this led into our goal, which we had from the beginning anyways, of really going out there and understanding the expressed needs of this population. And so this past year, using the BC Support Planning Grant, we've had the opportunity to sit down and answer this question, or begin to. And given up until this point, we didn't really know who our population was. As we moved forward, there really was an intentionality from myself and my research colleagues that we really wanted to engage patients in this opportunity, now that we kind of knew who was out there or where we could access them. And so this is where, in theory, our patient-oriented research started, although our desire to do this was very much from the beginning. And I think for me, upon reflection with patient-oriented research, I think this really is the key for, as health authorities and healthcare researchers, to creating not just patient-centered care, but evidence-based programs that really meet patients' needs. There's this image from the BC Support Unit website that I think really captures it well. When we engage patients as partners early, when we're building the evidence, we're going to make sure that we're ending up with programs that are built on good evidence, but also right from the beginning built with our patients involved in that. We're identifying their priorities and their outcomes right at the beginning, which I think is so important. And so we've, as a team and as I share, have really learned so much from our patient partners. And I just would encourage those who do research to really consider right from the beginning having patient partners involved. Whether it's all the way back to creating that research question, we want to be researching things that are meaningful to these people we want to ultimately see an impact in. And so engaging them as a partner, same level, valuing their expertise as much as our researcher, I think, is what helps build that to take place. So for our